Hey everybody, my name is Walter Giuliano, and today I'll be talking about the coronavirus in New Jersey and how it could extend the quarantine. The coronavirus could extend the quarantine beyond the original date for New Jersey residents and has the potential to turn into a full lockdown. With cases of coronavirus on the rise, the hopes of ending quarantine could fade away and turn into something that restricts the public more than ever in the history of New Jersey. Starting off, the U.S. is currently has the most reported cases of COVID-19 at 395,011. This is as of April 8th. The numbers began shooting up around March 18th and rose exponentially. New Jersey contributes to 44,416 of these cases, the reported cases. And in New Jersey, the first case was reported on March 4th, and by the 9th of that same month, New Jersey went into a state of emergency. Then later in the month, on March 27th, the President, Donald Trump, issued that New Jersey had a major disaster declaration. On March 16th, all schools and colleges were closed and restaurants were permitted to only do takeout. This also came with strict social distancing rules, where people had to stay at least 6 feet apart. On March 21st, all the non-essential businesses were forced to close, along with all social gatherings were canceled, including weddings, parties, or anything that was a larger group than 50. Because of this, New Jersey residents were required to stay home. On April 7th, the governor extended the public health emergency in New Jersey by 30 days. So when it was supposed to end by April 9th, it extended to March 9th. Now, New Jersey hasn't been prepared enough. Medical supplies had to be donated from companies in other states, along with the establishing of drive-through testing facilities. That way that people could be tested faster and they wouldn't have to wait in lines in hospitals or not be tested at all. And this also came with field hospitals that began construction after they were approved by the governor. This is in preparation for the surge of cases, which is predicted to hit in the middle of April. Because they weren't prepared enough, they had to get outside help, and this causes delay, which allowed the spread to happen even faster since they couldn't contain it in the beginning, which shows how New Jersey wasn't prepared enough. Then later on, New Jersey governor states that residents are not social distancing enough. Therefore, he closed down state and county parks on April 7th in order to force people to stay inside and away from others, which would, in his hopes, flatten the curve faster. So how this is looking out is that COVID-19 is turning into one of the worst tragedies in New Jersey history ever. This pandemic has taken a sharp turn that many people did not expect or were prepared for until it was too late. And this is one of the reasons why New Jersey is the second most infected state in the U.S. Also, this has to do with us being so close to New York and having one of the most popular international airports, which is Newark. With the number of cases spiking and the surge is expected to hit in the middle of April, the coronavirus is likely to prove to be too much for hospitals and health department to handle, especially when hospitals are shorthanded with staff that are being overworked, personal protective equipment to help ensure the safety of the people that are coming into the hospital that aren't sick with COVID-19 and the staff working on them, and then medical equipment that keeps people alive that aren't infected with COVID-19 or that are. The government is trying everything they can to prevent the spread of the virus, but with the residents refusing to follow social distance requirements, the virus is able to spread much faster and much further. This is especially concerning since the symptoms of the virus can be dormant for up to 2 weeks, so people could be infected with this virus and they would never even know, allowing it to spread further and further until they have showed the symptoms, and then at that point they could have had contact with hundreds of thousands of people. Not hundreds of thousands, but hundreds or thousands. There is another outcome for this. It is unlikely, though, but the surge can be contained and handled very well by hospitals. If they are able to acquire the help that they need from other nations, states, and companies in terms of getting this, more staff so their staff isn't overworked, getting the proper equipment they need, like personal protective equipment and medical equipment that they can use to save lives, then they can help those with the virus and save their lives, and in turn also help the people who aren't infected by the virus but have been in the hospital and are on life support or need medical attention, so that they can be saved as well. If residents see how fast this virus is spreading and how dangerous it is, then most of the residents will adhere to the social distancing order rather than going out and completely disregarding it. However, this really isn't likely because hospitals are starting to get overwhelmed now in terms of the equipment they currently have and how much the medical staff is working. And with the government saying that we're only a week behind New York in terms of cases than New Jersey, it can be in terms of cases, then New Jersey can be expected to almost triple when the surge hits, triple their cases, that is. It is also likely that residents will not residents will not practice social distancing and will continue to do so because they're either ill-informed or that they believe their actions aren't making the virus as bad as it actually is. Some recommendations I have is that the state could go into a full lockdown similar to what Wuhan, China has done. So what this will allow is the spread of the virus to be more contained and give hospitals a better chance to keep up with the rising numbers of patients that they are being overwhelmed with. It will also allow the hospital to save more lives since they can spread out the cases and they're not getting so many cases, so they can take the cases they have, treat them, and deal with the lesser flow of cases coming into the hospital. Now, this could be enforced by having law enforcement officers constantly patrolling the streets and communities and issuing heavy fines or even arresting those people or maybe subjecting them to arrest later after the quarantine. And that could be a way to help establish the lockdown and keep it in place. Now, if the states actually decide to go into a full lockdown, they will need to distribute a specific plan for residents to follow. They would definitely need to have a way for people to get food and supplies. One option is they can do what they did for the gas shortage back in the 70s, where if someone had an odd number at the end of their license, they could go and get gas on an odd day. And if someone had an even number on their license, they could go get gas on an even day. And then if they did something like this, they could use like social security numbers and people could go to the stores on those certain days, or they could schedule towns to go to stores on certain days, or somehow they can work it out like that. Another thing that they need to do, or if they don't want to do that and they want to keep people inside, they need a system where they can drop off supplies and food and even like medical supplies for those who need it to each resident where people are staying. They would have to need a plan for that. So they would also have to be extremely transparent with the residents in order to get full support. That way residents are informed, they know what's going on, and they know what they are doing to help the cause. Because of this would be a drastic change for the way of life for everyone. So this is why they would need to have a devised plan given to the public, law enforcement enforcing it, and be transparent so the public would know what is going on. Another way to enforce like a thing where people, like maybe if they don't want to do the lockdown, what they could do instead of to enforce the social distancing orders that are already in place is they could have hotlines that are open to the public that connect to police agencies, and that these people could report whenever they see someone in a large group or people going outside that they don't need to be. And this would allow the officers to figure out what the issue is and solve that problem and keep people inside. And it would also give the officers an immense amount of visibility of their communities. And in turn, even though the hotlines are on within the first couple of days, this would work as a deterrent since people know that they're getting fines or potentially being arrested for being outside and breaking the lockdown or the social distancing order, whichever one the state decides to pursue. So as of now, it appears the virus is only going to get worse before it gets better. With the residents failing to take social distancing seriously, the lack of necessary equipment and staff in hospitals, and the surge soon approaching, the virus could be very overwhelming for the medical staff and hospitals. This could also lead hospital staff to leave from being overworked or even fearing for their own safety and the safety of their family more than their desire to help people. The quarantine will likely be extended into early summer, if not longer, to ensure the spread is minimalized and so hospitals can recover from the surge and continue to treat patients. This means that residents will have to stay in the quarantine and continue social distancing to help flatten the curve. This could definitely create hardships on residents financially and socially. Financially because they don't have a job, even though they are getting unemployment checks plus a stimulus bonus. That can only last so long before people aren't able to afford their bills anymore and they run out of savings. Socially, it's because people have never experienced something like this, and having to stay cooped up in your home could make people very uneasy and anxious since they won't be able to go out even to like basic things like working or shopping like they normally would. So that's why some of the people would, and a lot of people have never experienced something like this, so it would make it very hard for them. Also, if the governor believes that if New Jersey is a week behind New York, then the government can see how the state will be with positive cases of coronavirus when we get to the same point New York is at. And this will allow them to compare our medical capabilities to the estimate of what the situation could progress into. This could help medical personnel prepare for what is to come and essentially be able to handle it way better. The state would be able to make requests for the help it predicts that it needs, and this would give the medical staff more equipment that they need, because they could put requests in, and other states could help, or other nations could help fill in the gaps of where our medical equipment is lacking. However, if the government fails to predict what the COVID-19 cases may become, or not be able to obtain the medical equipment necessary to fight against this virus, it will definitely the spreading will most definitely likely increase, and this could cause hospitals to easily be overwhelmed with more deaths from COVID-19, and residents could be forced into quarantine longer in order to contain the virus, which in turn would just turn out bad for everyone. So if the government is able to, they should they should predict what kind of medical equipment they'll need and the staff they'll need, and then make the appropriate requests, and this could end up helping out the COVID-19 cases severely or significantly. Thank you.